are in LA County are in the Department of Health Services. More than 1,000 budgeted nurse positions remain unfilled in LA County. LA County must act now, come back to the table to work with the nurses. Address the chronic retention crisis. If you have a child that's abused verbally, physically, sexually, chronic injury, near fatalities, you're going to see a public health nurse. We have a severe epidemic in diabetes and asthma deaths, which should never happen. Obesity, children even under 5 years old are obese. Sex trafficking, which you had a thorough report. They're snatching our children off the streets. We also have the autistic children that are having problems. These are all chronic things that we have in our vulnerable population. Public health nurses, we also respond to hepatitis A, STD, typhus, bacterial infection. That's a new rise in the epidemic for our population. We also deal with flu outbreaks. We also were there when the fires broke out. Nurses were there during the weekend helping those particular family members that were removed from their homes. Our public health nurses were there and helping them. Whenever a case or referral closes, I feel it breaks my heart because I can't get to that child in a timely manner to impact that child, to help prevent the parents from having child deaths and asthma and other medical diagnoses that we have. That breaks my heart. LA County needs to come back to the table, pull the nurses back to the table to resolve this chronic retention problem.
Next speaker, please.
Yes, esteemed board, my name is Lillian Cabral, and I'm Executive Officer at SCIU 721. Thank you, and thank you to the department directors from Public Health, Mental Health, Health Services, and Fred Lee for the revision of the health agency priorities. In the past, we have worked along in achieving positive results, but at times, again, we have proven together we win more and we create win-win scenarios for the communities. Together, we partnered and gained the 1115 waiver. Together, we built 65 continuous improvement teams. Together, we built our very own agency logbook model. Together, we made commitment to transform LA County and provide better patient and client care for our communities through the health agency. Our LMTC partnership, we have worked for the past year on just culture, and the impact, and it's really working right now. The impact is making a difference. We train thousands of managers, supervisors, frontline staff, and we're on our way to a real final culture transformation. It is truly tremendously rewarding to see that just culture is part of the new agency priorities. Together we'll accomplish anything. Together we must continue to overcome the obstacles that come in our way. Today our nurses are sounding the alarm to deep-rooted issues and obstacles. The retention of qualified nurses. We have lost 1,671 nurses in the past 3 years. We are prepared to stand strong and united to bring this issue forward and identify the solutions. We cannot ignore this alarming number. We cannot move forward one more year without identifying solutions for this problem. We need to address this impact, and we need to do it now. As we are prepared to launch this new set of agency priorities, we are urging you to stand together with us and address these matters. Thank you.
Thank you. Before the next speaker, who has 2 minutes, please call, just a second. Please call more speakers up.
Thank you, Madam Chair. Will the following individuals please come forward? Q. J. Marie, Fiona Hinlin, Vivian Dew, Rab Jonathan Klein, and Patricia Ruiz. They've all signed up to speak just on item 17.
Go ahead, please.
Good evening. My name is Cynthia Mitchell. I'm a registered nurse at LAC USC Emergency Room, and I have been employed with Los Angeles County for 18 years. Becoming a registered nurse has been a rewarding career. We get our honor by doing what we love to do and take pride in taking care of others. Unfortunately, LA County's failure to retain experienced nurses makes it harder for us to do the job that we love, and this chronic retention crisis is putting the safety of our patients at risk. As an ER nurse, I see the impact that this revolving door has our patients and the nurses struggling to maintain quality patient care. As frontline nurses, as experienced nurses, we have to do our across-the-room assessment and make a quick, critical decision that can mean the difference between life and death. As a level 1 trauma center, if there is a mass casualty incident or a natural disaster, if we don't have enough experienced nurses on the front line, we will not have the ability to effectively and appropriately accommodate patients' needs and manage their health care emergencies. There is no room for error. There is no room for delay. There is no room for short staffing when it comes to providing care for all walks of life. But short staffing is the common theme with Los Angeles County. Every second during a medical and/or a trauma emergency is crucial, and to our patients, lives being put at risk is unacceptable. Our registered nurses are constantly working out a ratio managing multiple critically ill patients. Some nurses have reported they have not taken a break. Some haven't even gone for the restroom throughout their shift. This is how serious we value our patients' lives. But nurses can't continue to keep working under these conditions. We get burnt out, overwhelmed, overworked, and completely undervalued. Training new nurses in Los Angeles County in order to replace leaving nurses in a couple of years should not be a solution to this chronic retention problem. The same patients that walk through our hospitals and clinics are the ones who elect you into office.
Thank you
The
very
county
much.
has an obligation to value the community and invest
Thank you,
in
ma'am.
dedicated nurses who provide quality
Thank
patient
you very
care.
much.
Thank you.